Hollywood legend and Oscar winner Michael Douglas has been facing a health crisis that could affect his career and his life. Since August, he's been battling throat cancer. Doctors say he has an 80% cure rate. He'll learn in January if the tumors have been eliminated. Our next guest, Dr. Jeffrey Hughes, says that your dentist and hygienist are the key to early detection of oral cancer. Doctor, thank you so much for being here.
Good to see you.
So you would think a celebrity like Michael Douglas might have caught this a little bit sooner than stage 4.
Correct. You know, unfortunately, people just don't go to the dentist like they're supposed to.
So that would be the key.
The key is early detection. You know, 37,000 cases are detected every year, and unfortunately, those result in 8,000 deaths.
Wow. Fortunately, though, you have some new equipment that might assist with the early detection.
Yes, we're very excited about this. This dental oral examination system was just released last week at the New York Dental Show. We're the first people in Connecticut to have it, and it allows us to fluoresce tissue so we can actually see lesions in people's mouths that could possibly be cancer, but the key is early detection.
But what happens if you don't have insurance or you're not going to the dentist? Are there prevention methods at home?
Sure. I mean, the prevention methods are smoking, alcohol. You've got to stop that. You know, people who are smoking more than a pack a day or a pack a day, it's terrible. Decreasing alcohol content in their lives, very critical. And the other important thing is that if you have a consistent sore in your mouth or you have a constant sore throat, you've got to go to the doctor. It won't go away.
Okay, so how often should you see your dentist?
Well, you know, we'd like to see people twice a year for regular preventive maintenance. And, you know, the truth is that the hygienist is the one that sees these patients. And so the hygienists are really key for this early detection of disease and also seeing the dentist. But sometimes, if you don't have insurance or you're not that committed, you have to take it upon yourself. So you need to look in your mouth. And if you see something that looks like it's changed color, especially on your lips, because melanoma occurs on people's lips, so it's important when you see a change, don't be frightened, but go to the professional.
Sometimes dentists get a bad rap. Patients don't like going, but one of my favorite places is the dentist.
Nice.
I don't mind that at all, but let's go back. You're heading to the dentist, you have an appointment. Some key questions you should ask.
I would specifically ask the dentist and the hygienist, are you doing oral cancer screening? And if the answer is, well, I can, please do. But most of the dentists in our area, they're doing these cancer screenings. But if he's not or she's not or the hygienist is not, you need to ask them to do this.
Okay. So we have this new equipment. We're going to have a demonstration momentarily. But what was the old way?
The old way really was just sort of looking and feeling and trying to notice subtle changes. There were other products on the marketplace, but they were expensive, and they were expensive to buy, so the dentists were a little resistant to buying them. This system is relatively inexpensive, so every dentist should be getting it.
All right, doctor, why don't we step into your office
Sure.
and see this in action. Well, you have a patient here waiting.
We're lucky enough to know this patient very well. My wife was very nice to consent to having an examination. Good morning, ma'am.
Good morning.
Welcome to my practice.
It's a lovely office you have, doctor.
Lovely office. So when we examine our patients and we look in our patients' mouths, what's interesting is, of course, the dentist is going to put on gloves. He's going to put on a mask. And even though I know this patient very well, I'm still going to put on my mask.
Okay.
And we're going to ask this patient to please open their mouth. And when we take our hands and we look in their mouths, we look for changes that we might see. In the past, this was all we would do. But now, I have these special loops that I put on with this special light.
So the patient is going to have these glasses on, I would assume.
The patient's going to have the glasses on. And this special light, could you open for me, please, allows me to see if, in fact, I see any changes. And what's important to understand is it's not to alarm the patient. It's not to alarm the patient. Could you say ah for me? Could you please stick out your tongue? And holding onto her tongue, looking at the side, checking and making sure that the light is on over here and checking and seeing. That's great. and over here. And when we're finished, please close. We then take, and we also do an extra oral exam where we're checking to see if we feel any changes in the nodes, in her face and her neck. Here, please ask the patient to swallow once so we can see if there's a change in the movement here, and everything is fine. So, ma'am, you look absolutely fine. Now, let's pretend for a moment that I did see something.
Yes, what would the next step be?
What we would do is we would probably consider doing a little minor biopsy, and so we could be sure that there was nothing in her mouth that we needed to worry about.
And it is not uncomfortable for the patient.
It is not uncomfortable. This examination with this new system is not uncomfortable at all, and it's very easy and very, very thorough.
All right, doctor, so the key here is early detection and prevention. Early
detection, prevention, and eliminating the risk factors, alcohol and smoking.
All right, very good. Thank you so much for being here. And if you want more information on Brush and Floss Dental Center in Stratford, all the information is on the screen. And of course, you can always come to our website and click on Connecticut Style. Doctor, thank you so much for being here, and patient for being our model this morning or this afternoon.